Hey there, this is Dr. Osar. I hope you've been enjoying this video series. Welcome to part 4 of improving thoracic rotation in your general population clients. If you missed parts 1 through 3, feel free to check out the link above this video and stay tuned for a very short, brief announcement after this video about a very special program that we're offering. Remember we talked about improving thoracic rotation. There are 3 key components, in fact 3 principles. Principles of the integrated movement system. Alignment. We must align the thoracolpelvic canister. We must make sure that the thorax is stacked up over top of the lumbar spine, which is stacked up over top of the pelvis. And our entire thoracolpelvic canister should be stacked up over top of our base of support. We must also be breathing 3-dimensionally. So again, we must be a liner TPC, we must breathe 3-dimensionally to create optimal intra-abdominal pressure and intrathoracic pressure, which is our primary means of stabilization. Finally, we must learn how to control. We must be able to have static control of posture as well as static control or dynamic control of this alignment of the thoracolpelvic canister, so that when our clients are developing and going into rotation patterns or side bending patterns, they're able to have the control they need to keep the joints in the proper position for loading and movement. When we have proper alignment, breathing, and control, the nervous system will open up the possibilities for rotation. So again, those are the 3 principal keys to improving thoracic rotation. I'm going to talk about just a couple of additional patterns that we do with our clients to improve thoracic rotation. So again, with a medicine ball, cables, bands, whatever tools you like to use, we can do a variety of patterns. We can do high to low chop patterns. We can do sagittal plane chop patterns. We can do rotation patterns. So the pattern does not matter that you use with your client as long as they're maintaining proper alignment, breathing, and control. They will maintain their rotation, and then you can start to improve the rotation once they've earned the right to get to a higher level of rotation. Just as it's important to know which patterns to use with your clients to improve thoracic rotation, it's also important, and for many clients, it's more important to understand which patterns you don't want to use, especially rotation patterns that can actually start to limit thoracic rotation and actually lead to low back pain. Here's one example of one pattern you don't want to do with many of your clients, and that's a seated trunk rotation. It looks sort of like this. Clients are sitting on the floor or up on a table as I'm doing here, and then they're just rotating back and forth, and they really like this exercise because they really feel it in their obliques, they really feel it in their abs, and I think it's a great exercise. Here's a challenge with this type of rotation pattern. First of all, most of this rotation really isn't coming from the thorax, it's actually coming from the lumbar spine because they're not able to stack and get their pelvis up over top of their femoral heads. They're not able to stack the thoracolpelvic canister, so they can't get optimal rotation. So what they're really doing is just rotating from that thoracolumbar junction in their lumbar spine, and it's a direct cause of low back pain and disc issues. So this exercise is really challenging for most individuals and really shouldn't be done by most individuals. Here's how you modify this pattern to make it more appropriate. What you have them do is simply lean up against a surface so that they can maintain that thoracolpelvic canister, hold the ball out in front, and now they can start to rotate, again, within that range of motion that they can control while maintaining that alignment, breathing, and control that we've been talking about through this video series. That's how you modify exercise and keep your clients from doing exercises that are actually detrimental to their thoracic rotation. So I hope that makes sense. I hope this video series has helped you become a specialist that your clients need, want, and your potential clients will seek out. What's the number one thing that the general population, the baby boomers and seniors, the pre and post rehabilitation, the pre and post natal, and everyday individuals want and are willing to pay top dollar for? Quite simply, the answer is they want to be able to stabilize and move with greater efficiency so that they can safely and effectively accomplish their health and fitness goals. Of course, they will really tell you that in those exact words. However, here's what they are more likely to say to you. I want to be able to bend over and lift my grandchild without experiencing that constant lower back stiffness. I want to be able to go for a walk with my friends without getting that chronic hip discomfort that always stops me. I want to lose weight, tone up, lose a few inches, but my shoulder keeps bugging me when I go to my exercise class. I want to be able to work at my computer or read a book without feeling that chronic neck tension that causes me to take medication for relief. Every time I start working out, I get injured. I simply want to be able to exercise without getting hurt. I'm sure if you work with the general population, you can relate to some of these comments. These individuals are telling you in their own way that they need a specialist to help them learn how to stabilize and move. You can become that specialist these individuals need and want while getting paid top dollar to help these folks accomplish their health and fitness goals. Here's what I mean. Worldwide, there's a huge demand for fitness professionals who are skilled in helping individuals solve their postural and movement problems and accomplish their health and fitness goals. You see, most people realize they must live an active lifestyle, and given our sedentary population, that generally means they need to exercise and become more active. But a large majority of these individuals are experiencing chronic postural and movement dysfunction, and many of them just don't know how to be more active without getting injured. Unfortunately, many of these folks often turn to unreliable resources for information and follow the terrible recommendations they often find on the internet and/or advice they got from their well-meaning friends. Some of them will actually seek out professional help. However, as you are likely well aware of, very few medical professions have the knowledge outside of drugs and/or surgery to help these individuals. And unfortunately, even when they turn to seek advice from certified personal trainers, the information they receive is either at best fairly generic and often extremely inappropriate and contraindicated for their current condition. While some people can follow generic exercise recommendations and get results, for the vast majority of individuals, especially the individuals with chronic postural issues, muscle imbalances, tightness, and discomfort, these approaches will at best simply not work and are more likely to cause them further dysfunction and/or injury. Here's an important thing I want you to understand. Rarely will the individual with chronic tightness, discomfort, poor postural and/or movement habits respond to generic exercise recommendations. These individuals need a specialist, not another generic approach used by so many personal trainers who receive their training from an online course or one-day certification, or just learn a trendy new training method, or the healthcare professional that sees far too many patients to provide the individualized care and attention their patients require. These individuals need a specialist who understands how to assess, interpret the results of the assessment, can create a specific corrective exercise strategy, and appropriately progress them through a functional exercise program. And they need a specialist who understands how to adapt their program to take into account the individual's specific needs, given their medical history, current condition, and functional goals. Additionally, they need the help of a specialist who can help them make informed decisions about their general health and well-being. For example, how to sit at their desk so they don't get low back tightness, how to choose the right exercise that helps rather than hurts them, what exercise and activities to avoid, because for many individuals, it is more about stopping incorrect patterns that will make the greatest difference in how they feel and, more importantly, in how they function. While you can simply perform a Google search and find literally millions of internet resources for how to perform high-level exercises, information to blast your biceps, tone your tush, or create a chiseled core, there's a tremendous lack of information, as well as a lack of qualified individuals to work with those individuals we have been discussing, the general population clients that have chronic tightness, discomfort, as well as postural and movement dysfunction, and those individuals that just simply want to work out without getting injured. Unfortunately, even when you find information that seems relevant to these individuals, it is generally the same generic recommendations repeated over and over, and they are often based upon outdated and misguided information. So where do you turn to find reliable information to help these individuals? My wife Janice and I created the Integrative Movement Specialist Certification Program to specifically address the needs of the individuals we have been discussing, because there was an overwhelming lack of reliable and practical resources available to us, the fitness professionals that primarily works with the general population. The Integrative Movement Specialist Certification Program is an exclusive and intensive immersion program to help fitness professionals like yourself develop it into industry specialists, more specifically, movement specialists. This program was initially developed out of a need to help us work with our own general population clientele. You see, I've been part of the health and fitness industry for over 17 years and have been through countless certification programs, specialty training programs, and continuing education courses. For many years, I worked with the general population clients using things I learned from all the top trainers and gurus in the industry. And while sometimes I got results, often I found these individuals either got limited results and/or the strategies I was using was causing more problems than they were solving. Desperate to help these individuals, I started researching exactly why so many people develop postural and movement dysfunction, why they got injured, and what kept them from being able to exercise at the level that they want. I integrated all the information about how the best individuals in the world were teaching their clients and patients to improve posture, stabilization, and movement. Over many years, I assessed thousands of individuals, incorporating strategies from the rehabilitation, strength and conditioning, and performance industries to identify and discover the absolute best practices. And then we made sure that these strategies were repeatable, not just with the high-functioning individuals like athletes and Hollywood types, but on everyday clients and the ones with postural and movement dysfunction. That's how and why we developed the Integrative Movement Specialist Certification Program, to help provide you with the best strategies to help your clients and develop your industry expertise. Here's something I want you to realize about being a specialist. Being a specialist or industry expert is not about knowing the most amount of information, having the best techniques, and or utilizing the latest trendy training methods. Being a specialist is all about having the fundamental knowledge about how the human body works, the functional anatomy, biomechanics, and neuromotor control. Understanding how to look at the relevant research and understanding what the research is and is not telling you. Understanding relevant topics like stabilization, control, and corrective exercise. For example, do you know when it is appropriate to brace and when bracing is actually contraindicated? Do you know how to determine what range of motion to train someone through and how to use corrective exercise strategies to improve range of motion without stretching? Or how to use breathing to improve alignment and activation of core muscles? That's why we developed the Integrative Movement Specialist Certification Program, to help you answer these questions, discover how to sift through the vast amount of information that is out there, and in turn develop yourself into a specialist so you can best serve your current clients and attract more of your ideal clients that want and need your help. How many of your current clients are experiencing low back tightness and or pelvic discomfort? Do you know if working with these individuals is within your scope of practice, or does your client need a chiropractic physician or physiotherapist to evaluate them? You will develop your skills so that you can determine whether or not you should refer them out, how to choose the most ideal health professional they should see, and intelligently communicate with other healthcare professionals so you build your professional network and even get referrals from these individuals. We created the Integrative Movement Specialist Certification to help you become a movement specialist. Understand that knowledge in and of itself isn't power. Knowledge plus application is truly what being a specialist is all about. And being able to apply your knowledge is what separates you as a specialist from your generalist colleagues. And being able to apply your knowledge to best help your clients and potential clients is what will get you paid top dollar by individuals that both want and need your expertise. We are confident the information you will receive in the Integrative Movement Specialist Certification Program will help you become a specialist your current clients as well as your general population clients need and are seeking out. From the perspective of someone who has been through countless years of education, dozens of industry courses and certifications, and created numerous books, courses, and educational resources, I'm going to be bold and say that the Integrative Movement Specialist Certification is the industry's absolute best training if you work with the general population. If you drive a Honda, you don't take your car to a mechanic that specializes in working on Ferraris. You take your car to a Honda specialist. Likewise, if you work with the general population, you should be seeking guidance from the coaches and trainers that work primarily with the professional athletes and Hollywood celebrities. I've taught around the world, shared the stage with some of the greatest names in the strength and conditioning industry, the rehabilitation and manual therapy fields, as well as learned from many of the pioneers of the industries. Turn to the professionals that work with the same audience that you do, so that you can help your clients find real results. If you want to stand out to your clients, if you want to be a leader for your clients, if you want to attract and serve the general population clients that want and need your services, then the Integrative Movement Specialist Program is for you. If you are ready to make that leap and you believe that we're a good fit for you, then join us to serve those individuals that need your expertise and help transform your client's health. To learn more about the Integrative Movement Specialist Certification, simply click on the link below or visit our website at www.fitnesseducationseminars.com. clientele.com. 4 modules, 4 weekends, a lifetime of usable knowledge. You're going to change a lot of lives with this information. We hope to see you at our next training beginning very soon.